Good morning. Thank you very much for inviting me to have this opportunity to speak to you about Hong Kong's plan on cancer prevention and early detection. My presentation will be divided into 5 parts, but I'm aware of the time constraint, so I will make my presentation brief. Looking at the global burden of NCD, these figures have already been mentioned by the Chief Secretary in his opening address, so I will not go into details. And the second commonest cause of death worldwide is for new cancer cases is amount to over 18 million, and estimated cancer death is 9.6 million. Approximately 70% of cancer death worldwide occurred in low and middle income countries, and about 1/3 of cancer death are caused by the 5 leading behavioral and dietary risk factors, namely high body mass index, low intake of fruit and vegetables, inadequate physical activity, tobacco use, and alcohol use. The global burden of cancer, you will note from this graph that it's increasing. Now, turning to the cancer burden in Hong Kong, cancer is the leading cause of death in Hong Kong, which accounts for 31.2%. And in terms of inpatient discharges and death for major chronic diseases, again, it tops the chart and stands at about 9.7%. And of the common causes of cancer in Hong Kong, in 2015, number of new cases diagnosed in Hong Kong amounts to over 30,000, and the top 5 common cancers are colorectal cancer, lung cancer, breast cancer, prostate cancer, and liver cancer. And it accounts for over 57% of all new cancer cases. In terms of cancer death, the statistics in 2017 showed that there were 14,310 deaths due to cancer, and the top 5 killers were lung cancer, colorectal cancer, liver cancer, breast cancer, and pancreas cancer. And cancer deaths account for 31.2% of all deaths in the year. This chart shows the aged standardized incidence rate of cancer in Hong Kong when compared with other countries. But I have to point out the time frame is not the same. For Hong Kong, it was based on the statistics in 2015, and for the rest of the statistics, the projected figures for 2018. You will note from this graph that we are seeing a rise in cancer burden in Hong Kong, and the leading one is colorectal cancer. As for the number of new cases, the projected number is projected to rise from 29,000 cases in 2015 to 42,000 cases in 2030. So there's a projected increase by 45%. Now I will turn to the policy framework and coordinating mechanism for prevention and control of cancer in Hong Kong. Hong Kong government attaches great importance to cancer prevention. And back in 2001, under the leadership of the then Secretary for Food and Health, Dr. Yok Chow, a cancer coordinating committee was formed. And it's tasked to steer the direction of work and advise on the strategies on cancer prevention and control. There were a number of working groups underpinning this cancer coordinating committee, including a cancer expert working group on cancer prevention and screening. And it's also supported by the work of the Hong Kong Cancer Registry. And also the hospital authority will be looking at cancer treatment services and standards. And the research office of the Food and Health Bureau will be supporting, including providing funding for cancer research and development. The Cancer Expert Working Group on Cancer Prevention and Screening have done a lot of work. It reviews local and international scientific evidence, assess and formulate local recommendations for cancer prevention and screening. So over the years, it has reviewed and reaffirmed or updated a set of screening recommendations for cancers, including cervical cancer, colorectal cancer, breast cancer, prostate cancer, lung cancer, liver cancer, nasopharyngeal carcinoma, thyroid cancer, and ovarian cancer. All these are put up in our website, so if you're interested, you can go to our website. On cancer prevention, indeed, most risk factors for cancer are preventable, and between 30 to 50% of cancer can be prevented by avoiding risk factors. So Hong Kong government have adopted a number of strategies on primary prevention. For example, we have health promotion and education efforts in collaboration with other governments, such as the Labour Department and Environmental Protection Department, in terms of prevention or reduction in risk factors. And we have provided vaccination programs to prevent cancers, including the free vaccination against hepatitis B for children up to the age of 5 at our 31 maternal and child health centers in Hong Kong. And we also introduced the cervical cancer vaccination pilot scheme for teenage girls from eligible low-income families under a 3-year pilot program, and this was funded by the Community Care Fund since October 26. The government have commissioned the Hong Kong University to do a study to inform the planning of the HPV vaccine for female adolescents in Hong Kong. The study has been published, and the Scientific Committee on Vaccine-Preventable Diseases and the Scientific Committee on Sexually Transmitted Diseases have looked into the recommendation and has put up a recommendation to the government. And the government is examining the recommendation and will be making some announcement very shortly. In formulating the cancer prevention strategy in Hong Kong, we took reference to the World Health Organization, including the WHO Global Non-Communicable Disease Action Plan 2013 to 2020. And the Steering Committee on Cancer Prevention formed a task force. The task force has been working since the last term of government under the leadership of my colleague, Dr. Regina Cheng, while the Cancer Coordinating Committee was chaired by the then Secretary for Food and Health, Dr. Goh Wing Man. And the task force put together a piece of work, and it was finally endorsed by the Cancer Coordinating Committee and put up to the government of Hong Kong, and it was endorsed. And our launching was graced by the Chief Secretary, Mr. Matthew Cheung, in May this year, and we published the TWATS 2025 Strategy and Action Plan to Prevent and Control Non-Communicable Diseases in Hong Kong. The Strategy and Action Plan covers 9 targets, which was actually in line with the 9 targets of the World Health Organization. And I will not repeat them one by one. I will just go through some of the targets with you which are related to cancer prevention. Target 2 is related to reduction in harmful drinking. When we do health education in Hong Kong, our community are generally very well aware of the hazard of tobacco control. On the other hand, the hazard of alcohol is not that well recognized. In particular, alcohol being a Group 1 carcinogen classified by the IARC was not widely recognized. So since a few years ago, my department has been stepping up efforts to do more education on alcohol. You will note from this screen the orange document is the ICRC monograph on the evaluation of carcinogen. And this report in 2008 is the report on alcohol. And at this juncture, I must express my appreciation to Mrs. Patricia Chi, Chairman of the Hong Kong Anti-Cancer Society, because since our discussion several years ago about the harmful effect of alcohol, in particular its carcinogenic nature, PAT has been very receptive. And since a few years ago, the Anti-Cancer Society of Hong Kong no longer accept alcohol sponsorship for their annual fundraising charity ball. I think it is important for the medical and health community and for NGOs to recognize the harm of alcohol in terms of cancer, and it is important that we must not let the alcohol industry to use your very well-intended platform to do brand building for the alcohol industry. And very recently in August, The Lancet has published a report on the global situation on alcohol consumption and do the analysis. And the report clearly points out that there is no threshold in terms of the cancer-causing effect of alcohol. In other words, there's no safe level to drink. If it's too technical for some of our participants to read the Lancet paper, you can go to the news report by, for example, BBC and CNN, and they have a very brief summary on the paper. So locally, we have introduced a number of measures, including plugging a loophole in our law, which will prohibit the sales of alcohol to minors, and the law will take effect in November this year. Exercise. Inadequate physical activity is widely reported in our children, so we must do more to promote physical activity for our children in Hong Kong. Alcohol. Hong Kong's effort on anti-tobacco dates back to more than 3 decades ago, and we have put up a lot of effort. You will note from this graph that the prevalence of smoking continued to drop, and the latest figures for prevalence of smoking in Hong Kong, it's 10%. It's probably one of the lowest in the region. But I must caution you that our efforts against the tobacco industry must be sustained, because our fight against the tobacco industry is getting tougher and tougher. And recently, locally, we are having a heated debate on the regulation of new tobacco products, including e-cigarette and other new smoking modalities. And we need a clear, strong voice from the medical profession and from NGO, and your voice will be heard. On obesity, ladies and gentlemen, watch your waistline. In Hong Kong, in a population, in the male population, for example, our latest population health survey shows that over half of our local male are on the overweight size. Why is it important? Because obesity is associated with at least 11 types of cancer. I will not count them, but you can go at the literature and read them out. So Hong Kong have started an approach, the life course approach, and our anti-obesity action start right in the antenatal period through educating the parents, and also we work with the primary school, the kindergartens, and the catering industry. Secondary prevention, it's also important, because apart from primary prevention, early detection and diagnosis of cancer at early stage is an important strategy. And cancer screening play a key role for selected cancers and for well-defined growth. Cancer prevention and screening should be grounded on fact, scientific evidence, local situation, and public interest. In examining whether to introduce a population-based cancer screening program, the government needs to carefully consider a number of factors and the actual circumstances. The overriding concern is whether population-based screening will do more harm than good to society. So to date, there are concrete evidence to show that cervical cancer screening and colorectal cancer screening for average risk individuals are the 2 population-based screening programs which, when organized systematically, are considered safe and effective in reducing cancer burden and mortality in Hong Kong. As for breast cancer screening in Hong Kong, there have been a lot of discussion in Hong Kong in recent years. And the latest review by the Cancer Expert Working Group on Breast Cancer Screening was made last year, which supports evidence-based screening for women at high risk of breast cancer. However, it is unclear to us at this stage that whether population-based mammography screening does more harm than good to asymptomatic women who are at average risk. The full recommendation of the Cancer Expert Working Group recommendation was published in the Hong Kong Medical Journal in June this year, and the full report is also put up on the website. So if you are interested, you can go to our website to read it. Cervical cancer screening, it's launched in 2004, and the major providers are the Maternal and Child Health Centers and the Women Health Center of the Hong Kong Department of Health, and there are also participation by the local NGOs and the private healthcare providers. You will note from this slide that cervical cancer screening coverage is relatively less well taken in the low-income group, And that's why government have introduced a 3-year pilot funded by the Community Care Fund, which was launched in December last year, to target at the financially not so well-off female in Hong Kong. And this is done through subsidizing through 3 local NGOs in Hong Kong as the service provider. Colorectal cancer is another important population-based screening which we launched a few years ago through a pilot, and the result has been very encouraging. This is a highly subsidized program involving private-public partnership, and it's now regularized, and it will cover Hong Kong residents aged 50 to 75. And since its launch 18 months ago, over 7,000 colonoscopy were performed. We picked up 4,900 adenoma, 458 adenocarcinoma, and over 900 other conditions. The way forward, cancer prevention and control is indeed a major public health challenge. So Hong Kong government will continue to maintain surveillance on disease burden of NCD in Hong Kong, including cancer. We shall promote healthy lifestyle and cancer awareness. We shall implement evidence-based primary and secondary cancer prevention program. We shall support the work of the Cancer Coordinating Committee and its working group and encourage cancer research. I would like to end this slide with you. It shows a calligraphy by the late world-renowned sinologist Professor Hon-yee, who at my invitation wrote this calligraphy, 姊妹病, which in translated English means treat not those who were ill, but treat those who have not yet fallen ill. And this calligraphy is presented to the World Health Organization of the Western Pacific region, and it's now placed in its gallery. So with this slide, I would appeal to you to join government, and together we will fight and prevent cancer, not only in Hong Kong, but globally. Thank you.